Yellow fever and malaria are growing epidemics in Vietnam and Southeast Asia. They are not only affecting the local population, but are affecting American citizens in the area especially heavily. The two illnesses are both transmitted by mosquitoes, and that's their main similarity. Malaria is a mosquito-borne parasite, and symptoms of malaria include fever, shivering, joint pain, vomiting, anemia, and convulsions. Some people may feel a distinct tingling in the skin, and this is a classic symptom of malaria. Another classic symptom of malaria is a cyclical occurrence of sudden coldness followed by rigor and then fever and sweating that lasts for 4 to 6 hours. Malaria has been found to cause cognitive impairments, especially in children, and this is one of the reasons why it's such a dangerous disease and dangerous illness and we need to treat it. It causes widespread anemia during a period of rapid brain development, and this can cause direct brain damage after the malaria passes. And this results from cerebral malaria, which is most common in children. And malaria has been shown to damage some of its victims' IQs by up to 30 points. And this is a very serious problem. We need to address it by funding malaria vaccination and prevention. Yellow fever, on the other hand, is not a parasitical disease. It's a viral disease, but it is also primarily transmitted by mosquitoes. And the virus remains latent for 3 to 6 days, and there are two distinct disease phases. And occasionally, it has no symptoms at first, but then this is followed by an acute phase, which is characterized by a fever, muscle pain with prominent backache, headache, shivers, loss of appetite, and nausea or vomiting. The high fever is paradoxically associated with a slow pulse, and after 3 to 4 days, most patients improve. These are very serious, and we need to treat them as such and effectively. Fortunately, we know how to prevent the transmission of malaria and yellow fever, and it's just the act of doing it is what we need to do. And the World Health Organization should target increased knowledge about malaria and yellow fever controls, and specifically those of controlling mosquitoes. And this can be done by using insecticides, protective clothing, and screening of houses. And people should always use an insecticide spray, especially if they're not native to an area that has high incidences of malaria and yellow fever. And in affected areas, mosquito method controls have been proven to be effective in decreasing the number of cases, but however, this is not enough, and we must find effective antiviral and antiparasitical drugs that have both been developed for malaria and yellow fever. And we need to fund the distribution of these drugs and combine it with effective mosquito control methods to curb the two illnesses. In summation, I'm asking the World Health Organization for $75 million, $25 million for chemicals, nets, and other mosquito controlling methods, and the remaining $50 million for anti-malarial and yellow fever drugs.